Did you know that the lack of sex after the age of 50 can affect your life in ways you never imagined? We're talking about consequences that go far beyond what you might expect. Not only does it impact your relationship, but also your physical and mental health. In this revealing video, we will explore these hidden implications and, most importantly, how you can reverse this situation to live a full and happy life. Before we begin, leave a like and subscribe to the channel to keep receiving this kind of content. This helps the channel grow and brings even more valuable information to you. Don't miss any detail of the video. Every point can transform your view on the subject and help you take better care of your life and well-being. The lack of sex after the age of 50 is a common but often underestimated reality. As the body ages, factors like hormonal changes, health conditions, and relationship challenges can affect the frequency and quality of sexual relations. However, what many people don't know is that the absence of regular sexual activity at this stage of life can trigger unexpected consequences, both physically and emotionally. From a medical perspective, sex is not only a source of pleasure, but also a practice that promotes overall well-being. Scientific studies have shown that maintaining an active sex life in middle age and beyond can be beneficial for cardiovascular health and help reduce stress levels. The release of hormones like oxytocin and endorphins during sex plays a key role in providing feelings of relaxation and contentment, helping to improve mood and alleviate anxiety. Self-esteem can be deeply affected by the lack of sex. For many, physical intimacy is a way to validate their body and maintain an emotional connection with their partner. When this connection is disrupted, whether for physical or emotional reasons, it is common for feelings of insecurity and even isolation to emerge, damaging not only the relationship with the partner, but also the relationship with oneself. The absence of sexual activity can worsen or contribute to the onset of health problems, such as erectile dysfunction and vaginal dryness, especially in menopausal women. These conditions can further hinder the recovery of a sexual life, creating a vicious cycle of frustration and detachment. In some cases, the lack of sex can even affect sleep quality, as the sexual act releases hormones that promote relaxation and help regulate sleep. Fortunately, there are ways to address this reality. Open communication between partners, therapeutic counseling, and even medical treatments can help revitalize sexual life after the age of 50. Facing this phase naturally and seeking proactive solutions can not only improve sexual health, but also strengthen emotional bonds and ensure a higher quality of life. The absence of sexual activity can have significant physical consequences for the body, going beyond mere pleasure or intimacy. One of the first noticeable impacts is the decrease in blood circulation in the genital areas. Sexual activity naturally stimulates blood flow, contributing to the oxygenation of tissues and strengthening sexual functions. Without this stimulation, a reduction in circulation occurs, which over time can affect sexual health, impacting erectile response in men and vaginal lubrication in women. Another crucial aspect is the release of hormones during sex, such as oxytocin and endorphins. These hormones play important roles in relaxation, stress control, and promoting feelings of happiness and well-being. When sexual relations decrease or cease, the body stops producing these substances in adequate amounts, which can lead to increased irritability, emotional tension, and even sleep difficulties. These effects are often underestimated, but can negatively impact mental health and the quality of life of those already facing other challenges related to aging. Both men and women can suffer from a weakening of the pelvic muscles, an effect often associated with the lack of sexual activity. The pelvic muscles, which play a fundamental role in urinary control and sexual function, tend to weaken over time, especially in the absence of regular exercises or stimulation. This can lead to issues such as urinary incontinence, sexual dysfunctions, and even pain during intercourse. This weakening can become a problematic cycle, as the lack of intimate relations not only contributes to the loss of strength in this area, but also makes the return to sexual activity more difficult and uncomfortable, creating further barriers for couples trying to regain intimacy. Understanding these impacts is essential for men and women to take preventive measures. Specific exercises for strengthening the pelvic floor, such as Kegel exercises, can help maintain the health of this muscle group, and hormone therapies, when necessary, can restore hormonal balance. The important thing is to recognize that sexual well being is part of overall health and that its absence can lead to challenges that can be addressed with the proper care. The lack of sex after the age of 50 can lead to psychological consequences that go beyond physical desire, deeply affecting mental and emotional health. Sexual intimacy is an important form of connection between partners, and its absence can create an emotional void. When couples stop having intimate relations, it is common for both to report a feeling of emotional detachment, as if a vital part of the relationship is missing. This can generate feelings of dissatisfaction in the relationship, creating barriers that hinder communication and closeness. This emotional distancing can, over time, evolve into a sense of loneliness within the relationship. Physical intimacy not only strengthens the bond between a couple, but also reinforces mutual trust and security. When these experiences are reduced or eliminated, the feeling that the connection between partners is weakening often arises. This detachment can intensify over time, leading to a sense of emotional isolation that profoundly impacts the well-being of both individuals. The psychological impact of a lack of sex can extend beyond the relationship itself and affect individual mental health. The absence of intimacy and the resulting emotional detachment can contribute to the onset of depression and anxiety, especially in those already facing other aging-related challenges. The lack of a comforting and emotionally supportive space can intensify feelings of sadness and helplessness, reducing quality of life and self-esteem. It is important to recognize that, for many couples, physical intimacy continues to be an essential part of life even after the age of 50. Sex is not only about physical satisfaction, but also emotional and psychological nourishment. The absence of this intimate connection can lead to emotional frustration, especially when one partner still wishes to maintain this part of the relationship, while the other, for various reasons, withdraws. These issues can be resolved or mitigated through open communication and specific therapies for couples. Understanding the role intimacy plays in mental health is the first step toward restoring emotional harmony and strengthening the connection. Seeking professional help, when necessary, can be the key to revitalizing both the relationship and psychological well-being, promoting an environment of support and companionship. An unexpected consequence of the lack of sex, especially after the age of 50, is the direct impact on sleep quality. During sex, the body releases a series of hormones that play crucial roles in regulating relaxation and sleep. One of these hormones is prolactin, a substance directly associated with feelings of tranquility and the induction of deep, restorative sleep. When sexual relations decrease or cease, the body loses this natural hormonal release, which can negatively affect sleep patterns. The absence of these benefits can lead to difficulties falling asleep, interrupted sleep, or nights characterized by lower quality rest. Sex, by promoting physical and emotional relaxation, often acts as a natural mechanism for relieving stress and preparing the body for a peaceful night's sleep. Without this regular activity, the body may become more tense and stress levels may increase, making it difficult to achieve complete rest. Over time, the lack of quality sleep can have serious consequences for both physical and mental health. Sleep plays a fundamental role in restoring the body and mind. Lack of adequate rest is associated with a range of health problems, such as increased risk of cardiovascular disease, obesity, diabetes, and weakened immune function. Additionally, sleep deprivation directly affects mood, memory, and concentration, contributing to the decline of mental health. Psychologically, lack of quality sleep can exacerbate feelings of anxiety and depression, which may already be present in individuals facing age-related and sexual challenges. Chronic insomnia or sleepless nights affect the ability to cope with stress and daily pressures, creating a negative cycle in which mental and physical health deteriorate together. Maintaining an active sex life can be an effective way to improve sleep quality and, consequently, preserve overall health. For couples facing difficulties in this aspect, seeking alternatives, such as counseling or adopting practices that promote intimacy, can not only restore connection in the relationship, but also ensure more restorative rest, which is essential for longevity and well being. Recognizing the consequences of a lack of sex after the age of 50 is the first step for couples to take proactive action and seek solutions to revitalize their intimate lives. Sexuality in this stage of life should not be interrupted, and there are many approaches that can be explored to restore emotional and physical connection between partners. One of the most effective options is couples therapy, which offers a safe space to discuss difficulties, expectations, and possible frustrations, allowing both partners to better understand their needs and find ways to reestablish intimacy. In addition to therapy, open and honest communication is key to overcoming these challenges. Often, the lack of dialogue about sexual issues can create misunderstandings and distance between partners. Conversations about expectations, desires, and concerns help strengthen the bond and trust, facilitating the search for shared solutions. These discussions can reveal the need for adjustments in routine, adaptations to body changes, or even the introduction of new elements to keep the spark alive in the relationship. Medical treatments can also be of great help to couples facing specific difficulties, such as low libido or sexual dysfunction. Hormone therapy, specific medications, or non invasive interventions can restore sexual desire and improve the quality of intimate relationships. Many men and women, while experiencing menopause or andropause, find relief with these approaches, which bring benefits not only to sexual health but also to overall well being. It is important to remember that physical intimacy is not limited to sexual intercourse. There are many ways to maintain an emotional and physical connection that can be just as gratifying, such as caresses, kisses, and other displays of affection. For some couples, these forms of intimacy are as meaningful as sex and can help maintain closeness and complicity in the relationship, even in the face of temporary difficulties in sexual life. Finally, it is essential for couples over the age of 50 to view sexuality as an integral part of their health and well being, rather than something that must be set aside with time. With the options available today, from therapies to medical treatments, it is possible to maintain a healthy and fulfilling sex life at any stage of life, ensuring not only a better quality of life, but also a stronger and more connected relationship. Thanks for watching the video. If you found this content helpful, share it with friends and family. It could be the information someone is looking for to improve their health and relationship. The more people we reach, the more lives we can transform.